Hello and welcome to our Insights podcast, sponsored by the Value Edge Group. I'm Leon Herszon, your host, and I would like to welcome Dr. BK Nayak, an expert on AI in the healthcare industry. Welcome, BK.
Thank you, Leon, for having me.
So we are going to dedicate this episode today to talk a little bit about the use of AI in healthcare, which we are following. There is a lot of improvements, a lot of potential on the use of AI, right, in the healthcare. Before we even start, can you give us a quick overview about how did you get into this topic, this area? You are the CEO of Spikewell, and you guys provide AI apps and services for the healthcare, which is not an easy industry to get in. So I think our viewers and listeners would like to know what was your journey to come up to this moment here?
So, Leon, my journey started as I'm an engineer by training, and I used to develop semiconductor. That's where my PhD is about and all these things. So,
Semiconductors.
semiconductors,
Very good.
clean room, and that is where I used to make semiconductor fabrications. That's where actually my PhD was and all. And later on, I worked uh, in telecom division, optoelectronics, and telecommunication. At some point in my career, I went to do my MBA at Sloan School of Management at MIT. That's where I always knew AI is a big thing. It's disrupting the next, frontiers.
When was that?
It was 2018.
Oh, wow. Okay.
2018. So almost 6-7 years back. And that's where I firsthand got the enormity of this AI and what it is going to do. And I immediately realized right now is the time for me to jump in. And my luck would have it, I got really good mentors at MIT who gave me the opportunity to get into this field of AI, and particularly in healthcare.
Nice.
Healthcare, yeah. So that's where I got in, and I'm not any looking back. So moving forward with this amazing area.
I can tell you, BK, perfect timing. Exactly, perfect timing. Very good. So when we look to how AI can enhance healthcare, I can see there are several dimensions. You have one dimension which are the patient. You have another dimension which are the providers like hospitals, clinics, and etc. And you have another dimension which is the staff and management, right? So can you share a little bit more on each of them separately? Let's start with the patients. What is the benefit for patients? And before you answer that, I've been reading a lot about diagnosis. So AI being used to analyze X-rays, MRIs, CAT scans, PET scans in a way that is better, more precise than humans, right? So there's a lot of advance for the patients. For the patients, in your experience using your apps in the hospitals and etc., how their experience is enhanced by AI?
So, Leon, you touched exactly. I call it 3 Ps. Patient, it starts with patient, everything is with patient, and then the providers, and of course the management around the provider and the payer, which is insurance. These are actually three, I call it like a triangle. But patient is actually, it starts everything with the patient. Since we are discussing in a informal setting here, and to some extent, I can tell the future where it is heading. Exactly being, I can tell you, if the future of human health lies on something, it is actually AI. Okay. So far, let me tell you in a very broader picture. I will come to very specific. Of course, Spikewell does quite a bit of things in a different way. Which are actually the beginning of the things, but there is a much bigger thing I want to tell you. Today, if you go to a doctor, how much time you spent, not more than 15 minutes, right? And you go to, and he looks at your numbers, look at your data, which nurse has already measured, and give you something, and you come. No doctor today can actually treat a person. They treat a symptom. They treat a particular something is happening, and there is no way today, no matter how rich somebody is or how much access to healthcare he has, you cannot treat a whole body person. That is impossible.
The entire body.
The entire
Just
body.
oh, I have my shoulder is hurting, so they're gonna focus on that, but they don't see the holistic of you.
Holistic. That never. But a human being is a holistic. It is not the. It's not the combination of body parts. We are treating to the parts. We are treating to the organs. We are treating to the symptoms. And that's the reason, with the enormous development on healthcare and medical technology and science, we still not able to make people healthy and live long enough. Still, of course, tremendous progress has happened after penicillin is invented, antibiotic, and the human lifespan has 50% increased from Second World War
Yeah,
to today.
yeah,
It's
exactly.
definitely, it's like 50% improvement. 50 was average, now it is 75. But with AI, looking at the human as a holistic, we can extend it to tremendously healthy and happier life. That's actually one of kind of a mission for me in some ways too, and that excites me for
I
AI.
can see, I can see how excited you are with that.
So what is happening today is that is a symptom somewhere, as you said, but it might have many different reasons. And today, what we are doing, we're exactly putting there. Okay, you are hurting there. I'm going to give this the medicine and solve this. But there is no way. But with the AI, what can happen as AI takes over? AI will be the most personal doctor I will ever have, which even knowing some disturbance somewhere, it will predict and say, you know what, something bigger is going to happen. Be careful. And I believe we will come to a point where I will fine tune somebody's health to a point he remains in his optimal health for long term. And today that information is lacking. And then we go and treat them when something is out of control. We make a surgery, this, that, and all these things. And then, it has side effects and a trickle down effect and some other things starts to show. So with the AI and with the progress in AI, and particularly as a looking patient in holistically, we should be able to make human being live longer, healthier, and happier. That's the biggest promise. But today, we are in some. I have a little team which continue to work on those things in the side, but. But in the present scenarios, when we go to hospitals, that's where most of our work goes on. We see a lot of things in particular from the patient side. The patient's appointments, the payments, the navigation through hospitals. When is my next appointment? Everything is taken care. One of the another area I'm working on, Liam, since we're talking here, which is actually immediate impact to the patient directly, is post-discharge care. So hospitals are sending patients home as soon as the patient is operated because they're always wanting to take more. Patients are on the line. And one of the biggest problem is the readmission. But if the patient
Readmission.
readmission, that costs a lot to the hospitals. So one of the things is if once patient is at home, how the health is deteriorating, there is not a very good system today to monitor that and predict that. So we are working on a remote patient monitoring, where using artificial intelligence, so which can, just from the vital measurements, it can predict and say this patient is more susceptible, pay attention. So, so that the readmission doesn't occur. Second thing, another biggest problem, that is where the patient can get a lot of benefits because once readmission happens, things goes lot of out of control, and it becomes expensive, not only expensive, also from the patient. And the patient, not only that, the loved ones of the patient can also monitor that whether he is staying healthy, measurements are anything going up and down and all. So we are bringing those technologies directly to the patient. Okay. So I'm just giving some of the examples. There are some more also. So
Very nice. So how far are we to that future that you see? We already see a lot of a discussion on extending human life, as you just mentioned at the beginning, and etc. So how far are we that AI will be able to look to the individual holistically and not only the symptoms, but or is that already happening?
So, we are working on it, and I have. There are a lot of longevity startups and companies. It takes little time. So, particularly in the AI, what happens is that you need to observe the person for a longer period of time, so that
Yeah.
so technology is maturing. A lot of people are getting into this thing, and there is also a little bit of a trust. People still they're trusting humans. They, how the app is, how good it is. But in the beginning, it will come as a complementary. You still have your regular visit, but let's have this thing in the side. Uh, at some point, I believe it will take over. People will have the trust on the AI more.
And patients will start to trust more, right?
Trust
Because
more.
I know it's not exactly the same thing, but looking to a parallel, it's like the self-driving car,
Yeah.
right? The self-driving car, people get nervous to get into a self-driving car. You need a very a deep trust on that car. But as things progress, people get more comfortable. I think something similar might happen with patients related to the use of AI, correct?
Yes. Millions of people travel every day in flights, right? They're all in autopilot mode, except the takeoff and landing. There is not much actually the pilot does. We trust it. We completely trust it. So it takes time. But at the same time, the human touch is not going to go away. It's only going to get enhanced. Because as I said, imagine somebody is in a hospital setting or with care. In nurse particularly, one of the biggest problem in healthcare today is nurse burnout. What we call is nurse burnout.
Hmm.
There is a lot more patient to be taken care. There is not enough nurses, and even if those nurses they spend a lot of time on documentation and all kinds of things, imagine they could spend more time with the patient. Patient want to
Yes,
talk to them.
yes.
Patient want to talk to them. They want
The
that
human side. Yeah.
human side. We can tremendously enhance the human side. Today, almost 50% of a nurse time goes in documentation, different kinds of trivial things which technology can take over. She can actually spend double the time with the patient rather than doing this thing, or even 25% improvement would be pretty good. That is where the patient experience can tremendously go, and the nurse burnout will not happen, and this kind of things. So, you
So
know,
you actually mentioned the second, I think, as you said, the part of the triangle, which are the providers, the doctors, the nurses, the hospitals, right? And you mentioned burnout,
yeah,
right?
yeah.
Because you think a burnout is because of all the documentation required, or because of the number of nurses and doctors that are reduced, or both? What do you think is the main?
Healthcare organizations are always under tremendous financial pressure. These are non-profit organizations. They depend on, subsidies. Help from the government. The help from the donors, rich donors, and that is how it continues. Yeah. As the pressure mounts, they want to do more with less.
Mhm.
They want to do more with less. And the toll goes to doctors and nurses, particularly nurses. It goes a lot with the nurses. And at some point, what happens that it trickles down to patient because Imagine a nurse working like 10 hours, 12 hours restlessly. She would not have that pretty, happy, smiley face when he
Yeah, yeah.
meets the patient, and you can't blame her. And today, we can tremendously help them with technology that can augment with that. So let me tell you another important. It's not that there is not technology, enough technology out there. Why AI is becoming important? There is a term also, in Leon, just like we say Norse burnout. There is also called a technology burnout. Talk use in a
Technology burnout. Wow.
burnout.
Okay.
So we have this, massive electronic health record systems and this, and where to find what, document what time. That also some and mostly, the healthcare providers are not trained technology person. They are not technical people. One
Mhm.
of the promise of AI is that with the way technology today works, most of the places, which is rapidly being replaced by AI, and that is a great thing happening, is that we always fit into the technology. You will always say, oh, a new version of some software came. Now I don't know where the tab was used to be. Now I will find somewhere something. There's always a learning, there is an upgrade, there is a learning. So the way technology has been implemented in the world today, we always fit into the technology. But AI changes the game. Technology is fitting to you. So you work in your natural way, the intelligence will understand, oh, maybe you are needing that. So it will show you, just like a human being thinks, oh, maybe you are needing that. That is where a lot of this emerging field, exciting field of agentic AI is coming up. So there are different workflows, the co-pilot and agentic AI, these kind of terms. Your workflow, you are working, and a agent will start to uh, augment your work or start to help in your work as if like there is a person helping you. These are the kind of things coming. So you are not fitting into the technology. Technology is trying to fit into you. That's a big change. That's simple.
Very, very interesting. Yeah, and I can see how AI will never replace the human touch, the emotional aspects, and everything else. So what we are doing is we are taking out those tasks that take too much time, but that does not add value to the
Yes.
doctor patient
Yeah.
nurse patient relationship, right?
Exactly, exactly. So with the AI, it is not. A lot of people think, oh, this AI is coming to replace. No, it is not. It is going to be tremendously augment so that the human touch can improve, tremendously improve. That is what actually patients are looking for today. Human touch is going away. So that is where, and also it will not. This is one part of it. A bigger innovation also, everything has a cost. The cost will also tremendously reduce the care provider cost. I can just give you an example. Large hospitals, just the critical medicines and stuff, and they stuff it, right? Just a lot of things get wasted just because we don't have a proper analytics to optimize the use of the resources.
You mean uh, 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 like materials or things that people use, like gauze and things like that, and
That is actually one aspect. That is, you how do you order them and optimally order them
mhm.
and make sure that they are available where it is available. That is one thing that it can reduce your ordering and all. But even medicines, there are certain medicines they expire. If you
Oh,
don't
medications expire. Well,
medications,
you can tell that I don't know about this topic, right? My wife is the one who is a medical doctor. I'm an engineer like you, so. But yeah, give us more details on that.
so see, in one of the hospital systems we worked in the past, they typically lose almost $1 million per year just because they don't have a proper management on medicine.
Wow.
Can you imagine? That's a lot of loss actually.
Yeah.
Because and another thing is equipment use. Large hospitals, they have certain area in the hospital, there are equipment they're ordering more somewhere. They're not optimally using the equipment and the things. And there are certain areas where there is a lot of flooding happening, means a lot of loss happening. demand happening, but not enough resources going actually. So there's a lot of optimizations can happen so that hospitals can use resources properly. Wastage can reduce. There is a lot of large hospitals I have spoken. They don't have actually a tracking system on their major devices. Large, big hospitals with a good, have so much equipment. It's like when I passed, I came from clean room, as I said, my semiconductor background. And these clean rooms are massive, right? Huge clean rooms with
Hmm.
CVD systems, this kind of lot of equipment. When I went to some of the research hospitals, you go to their surgery department and all these things, they have no less than any clean room actually. They have much more. They are actually more cleaner than means they're like really, really like clean room. You feel like going and equipments everywhere. So I
Wow.
mean, and that gave me a different perspective. I said, so many equipment and all, you need to track them. It is not only just important for auditing purpose, but also it optimizes the resource to the best use.
So asset management,
Yeah,
knowing where things are, a medication expiration
yeah.
dates. Oh wow!
Ordering stuff from the beds, all these. These are tremendous resource saving coming through AI, optimized with analytics, and then comes AI on top of that, and that is how things move. Actually, it's extremely exciting that hospital healthcare sector is probably one of those sectors which will tremendously benefit from AI. Yeah.
So you actually already started mentioning also about management hospitals. What other benefits AI can bring to hospitals? You mentioned about equipment and medication and etc. How they can be more efficient, reduce their cost. You mentioned $1 million on waste, right? But what about innovation? Can AI help hospitals to innovate, to provide better services?
So,
Tell me more about.
So, Leon, this you brought the important point, innovation, and one of the book I'm suggesting, you will see that some innovation, and in the human history, probably we are reaching to a point when innovation is going to be so. We'll see the rapidity in which the innovation will come to life, and never before. Not even the invention of transistor, not even the graphical user interface, not even the best operating system or cloud computing. So of course, cloud computing leading to AI. Now we are getting into the age of intelligence, right? That's what we call age of intelligence. And the companies and the or businesses will be disrupted beyond imagination with AI, and which is a good thing actually. Which is a good thing. So in hospitals, what is happening, as I mentioned, there are many, many ways. So for instance, I'm giving an example. Um, let's say a nurse is putting all information. She took a lot of tests, this, that, and they wrote in a piece of paper. And at the end of the day, she has to enter all these things into an EHR system, right? Whatever the EHR system the hospital is using. As simple as I'm giving an example, we have a solution using robotic process automation, RPA. You have all these things, let's say documents, you just put it in a scanner, scan everything, and put it into a folder. A robot, RPA robot will go and look at it, open every PDF, look at the name and all, and it will put everything into the HR system as it is, whatever the measurement records
The
and
same
everything.
if the doctor records on a recorder,
Right.
takes that voice and do the same thing.
Same thing, we have actually, there is a solution called a QWell. We have for that actually. It's records and then creates soap notes. And not only that, it also provides the codes, the billing codes and everything it can put into, oh, you know. So these are, for instance, the revenue cycle management. We have a solution called Blue Dot technology. Blue Dot technology has two aspects. One is navigating the patient in the hospital.
Oh,
So
by the way, I don't want to interrupt you, but for our viewers and listeners here, BK showed me this Blue Dot technology. It's super cool. Man, I had to go to hospitals, and everybody here had to go to hospitals, and I got lost a few times. This thing is amazing. So explain to us how the
So
blue dot works.
So Blue Dot is an app in your phone, and you open the app. So Blue Dot has two solutions. One is for the patient, and one is for the hospital. So the hospital side, it is more about the managing the assets and stuff. And the patient side, so the patient can open the app and see when is his appointment, how far the hospital from here, where in the hospital he's going to park the car.
Which
If
corridor to
Yeah,
go as
which
well, right?
corridor? And once you reach the hospital, it will just a turn by turn guide you. Take this elevator, go to the seventh floor, take right, take left, and all the things. More important, you go there and reach. And these are all AI driven. If you lost the path, it will reroute into different path and stuff like that. But you might be thinking, okay, this is a great for the patient's navigation, and hospital is a stressful environment. You don't want to put more stress where to
Yeah,
reach, home to
exactly. Yeah.
reach. It's a great. But what is the benefit for the hospital? Hospital actually knows where congestion is happening, where they need more staff to be, which clinic is getting full, where there is a line happening. Everything they know behind the scene actually. So they can allocate and they mobilize their resources properly so that hospitals run effectively. And not only that, they can develop analytics. Which day of the month, which time,
What hour? What day?
a lot of these things helps them to what we call the heat map. It creates the heat map of the hospital and see where things are. And these are also connected to payment system. It is also, you can connect that to find my car. You got some surgery happened or doctor consultation happened and all these things, and then you want to get back to your car. You know that with the big hospitals, you don't even find where I
Right.
put my car. You can put your car and you can snap it and it will record this is where you put your car. Then you can go and come back and this kind of thing. So it brings a lot of things. Yeah.
All right. So, on that blue dot, you mentioned asset tracking. So, besides everything you said, it can also say where each equipment is, how close it is, and it's being used, or something like that, right?
When was the last time it was used? And where it was located and all these things. It can that is missing equipment is a big deal at hospitals. If you ask maybe your wife, she will tell in the hospitals these things happen quite a bit. They're missing. They're not finding where it was and things like that. So yeah.
And I know that there is one product that you guys, because you guys have several different products, and by the way, we all know how hard it is to get into hospitals. I understand that Spikewell serves one of the largest hospitals, children hospitals, I think in California, right?
Yes.
So that shows how successful you are. But I remember you talking about something QWell.
Yeah.
It's a queue system. What does it do?
So QWell is a smart queue system, smart queue system. So hospitals have, let's say, doctors. Doctors have certain appointment time. They give this time to the hospital. And imagine for various reasons, sometimes patient has signed up, but they don't show up
Hmm.
for personal reason, whatever reason they cannot. But that time, doctor remains idle, where the doctor could see another patient, imagine. So smart queue system, what it does, it prioritizes, and if it notices that something is being cancelled, it appoints in a smart manner who is the next who can take that to optimize the doctor's time actually. So that's actually a smart queue system where you optimize the hospital, I mean the doctor's time. Uh,
So
but
are you saying, because I'm pretty sure our viewers now are thinking, every one of us stay waiting for the doctor for a long time,
yeah, yeah,
right? And then we, oh my, why is it taking so long? Will this help? Will
definitely.
AI help that we don't wait for like half an hour, 45 minutes inside the doctor's office and waiting?
That is Leon, one thing. Another bigger problem, if you want to today take an appointment with a specialist, you have to wait 3 months.
Yeah.
Specialist appointments are really, really difficult. These are like regular, anybody visits doctor's office, waiting 1 hour is like, you can't complain there. At least 1 hour, which is non-productive to you. And, those things are definitely can be improved. But even for a specialist appointment, which is a serious 3 months wait time, imagine somebody, these things are optimized in a proper way. You can maybe wait time 3 months can go back to like 1 week. Somebody is canceling, and the smart system goes back and forth and look at who is the next priority. And if somehow you found that you are available to go on that day, why not take that opportunity? So those are the kind of things where it will be even more important.
Do you also see any type of improvement in telemedicine? Because telemedicine became very common after the pandemic,
Right,
right?
right.
So people had to, and I think today people are more receptive to have an appointment with a doctor remotely and etc. Uh, is there anything that AI is going to help or is already helping to get it even better?
Yeah, one of the things we do this remote patient monitoring. Part of that also we develop this telehealth technology. Part of it. So where things are heading. People used to go to, for anything happen, let's go to hospital or doctor or clinic. That is going to change. Hospital will come to home.
Oh,
So more and more people will stay where they are, because not only it is the cost. Once somebody goes to hospital, the cost really, really goes up. Not only it is the cost, but with the advancement of at least some basic technologies are evolving, and the cost of medical devices are also going down. The sensors, different types of sensors. That is a very interesting area I'm working really hard on. That you can, few $100, you can have most of the standard devices at home, at least to take some basic measurements, vitals and stuff. That can give a lot of indication. And then you can have a consultation over remotely, and your all the measurements and everything is in front of the doctor. She can just look at the things, and unless it is a really, really, she says something, there's no need to go to hospital. So, and also insurance are also covering now the tele visits and this even remote patient monitoring. It's a very good indication that things are moving. A lot of cases, I can tell you, if somebody is visiting hospital, lot of cases can be done remotely without going to the hospital. That's a good thing. And
wow.
future is we are not going to hospital. Hospital is coming home.
Uh, do you think that because of all those challenges that hospitals face and AI is helping now, that's one of the reasons why we got an increase on those 1 minute clinics? People don't go to the hospital; they feel something, they go to those little clinics, they get the medication, the appointment, and come back.
Yep.
Is it, and you think that with what you're saying, hospitals will be more effective and people will go less or need less of those, or you see a space for both? The hospitals with the entire set of equipments and everything else, and the small clinics that are across, at least in US. I don't know in other locations, but in US, there are coming a lot of those.
Yeah,
Uh, uh, uh,
that is exactly. So I think unless there is a major surgery and things like that happening, people should not be visiting hospitals a lot. And even today, one of the biggest problem is rural areas. Even in the United States, rural hospitals, they,
mhm.
people have to travel so long to make an appointment visit. And if a lot of those things can be done remotely at home, and the treatment or at least guidance and all these things, they don't have to travel that long. And also the remote locations, staff shortage is a bigger problem, and a lot of those things. So it's an exciting time for healthcare because of AI. Actually, which I can't
Yeah,
talk
it's
about that.
it's it's an exciting time, not only healthcare, but we have been talking. I had a previous conversation with a colleague about AI in education,
Yep.
corporate training.
Yep. Yep.
There is not a single industry there's
Yep.
not going to be touched,
Thank
and
you.
we really appreciate you sharing that. So, if somebody wants to learn more about AI in healthcare, uh, or maybe I can ask you this. Would you recommend one or two books or points of references for people to go and learn more? Let's start with the books. One or two books that were very significant for you
You,
so far.
Leon, I used to be a book guy, and you can see in back there were so many books. Those were a long time. I'm just carrying just because then Kindle came. I didn't buy the physical books anymore. In today's time, I'm telling anybody who wants to learn anything, go to ChatGPT. I'm just telling you, you will get latest things really curated. You don't have to spend time to read a book per se. Although my life started with books, like I'm sure you are.
Yeah.
But today the world is changing completely. You just go to ChatGPT, ask for this thing. It's curated. You can ask very specific, whatever you want, you get it. Today, I'm not recommending anybody. Although you asked me, and I have a couple of books which I suggested, but ChatGPT is the way to go. You will get a lot of things really, really good in.
So, the ones that you can recommend, the books that you can recommend. So you suggested people go to ChatGPT, and we can put here on the screen the book. What are the two books? I think you mentioned two of them to us during our conversation before. Do you have that on top of your mind? If
Yeah,
not, we're just
yeah,
gonna yeah.
yeah. Two books you asked me. One book is a business classic. It's The Innovator's Dilemma by Clayton Christensen. He was a professor of business school at Harvard Business School. One of my most favorite books. I cannot emphasize more the timing. This book is, of course, a business classic, and this is a time for that book also to think about for all business leaders.
Nice.
Because what that book talks about is what we call the creative disruption. We are on the cusp of that with AI and all. It is not a small disruption going to happen.
Yeah,
60
it's a big one. Yeah.
Yeah, 60 to 70% of all jobs are going to be affected by it. 60-70%. I think if somebody asked me which job is the most stable going forward, it will be a nurse job actually. So that is going to be the most stable because people need human touch. And so
Yes,
those
of
kind of,
course.
yeah. But a lot of other things will be disrupted. So what Clayton Christensen talks about, the core of this book is when businesses are doing good, money is coming, things are really, really good. That's where the problem starts. There is a small innovation starts somewhere and people don't pay attention to it and it takes over. So, like Blockbuster, Netflix
Hmm.
arms gone.
Yeah.
There were all the, Google come gone. All the different, search engines. There were many search engines. And something comes in the underground, and who knew that a book we will buy over? I mean, it started with a book. Look at Amazon. Um, the classical like Walmarts are there, but look at the business Amazon crafted out. The Kindle, I was so impressed when Kindle came. The way we read books changed. Um, Another big innovation which always excited me is AWS. First, when Amazon AWS, the cloud computing, it's like
Cloud
it's
computing.
probably the biggest ever happened. Apple came, there were Blackberry's market and all, how quickly, I mean, people thought, we need a keyboard, we need a keyboard, we need a keyboard. No, everything can be touched. So what happens is when businesses are doing well, that's where but right now, AI is just a telling. I'm going to disrupt, uh, adopt the innovation or not. That's what it
Yeah,
is right now.
yeah, yeah. And the
And
second book?
the second book is a spiritual classic I read long back, actually. It's called The Power of Now by Eckhart Tolle. You know,
Well, now it's also very timely.
it's the power of now because everything is happening now. Sometimes we don't think about it, but all our future is imagination, or it's all happening now. Even the memory of the past, this memory is being recalled in now. There is
Mhm.
nothing other than the now. The future is a projection of mind, the past is memory. And even that projection of a future or the recall of the memory of the past always happens in now.
Yes.
And it's a very subtle thing, but the moment we realize, we said, this is all I have, this moment. It's just a living moment to moment to moment to moment. And it's a very powerful message, but Eckhart Tolle puts it in a very simple way to different aspects. So I like that book a lot. So
Thank you for sharing that. And
yeah,
before I let you go, BK, final message to our viewers and listeners. What would you like to say?
I would like to say, keep the mind open, um, accept the way the technology is going to evolve, is going to transform our lives for better. Human beings were not supposed to created to do menial, mundane work. Actually, we are creative beings, and with the advancement of AI, although it will take away a lot of jobs and things, but maybe we will have a universal basic pay. People would not, because the productivity will go up so much. I'm really getting a positive thing. A lot of people think, oh, AI will disrupt this. No, it might happen that most of the people need not have to work so hard for basic requirement. Productivity will take over, take care. Human beings will be engaged in more creative way and healthier, compassionate, and loving world. So that is loving and happier world. That's what I am forcing with the technology and the advancement of AI. So we should remain positive and happy. Think you happy about the future. Good thing is going to happen. Yeah.
Thank you, everyone. Dr. BK Nayak, thank you so much. Really appreciate. If you guys want to learn more of what he's doing, spikewell.com. So he can get him. You can connect with us as well. We'll be happy to connect you with him. So thank you very much, BK. Have a great day.
Thank you, Leon. Thank you.